So I'm going to ask if Dr. Dara will get us started first.
Good evening, everyone. Thank you so much, Kyisha, for having me tonight. I am Dr. Dara Cobb-Lewis. I am a certified pastoral counselor, and I am out of the Charlotte, North Carolina area. I work with women, mainly women, but I also work with individuals, couples, and families of different types and sizes. And that's a little bit of who I am. I also take an integrative approach in my work, looking at the behavioral sciences and people's spirituality, theology, and religion, and couple those together for the work that I do.
Thank you. Miss Yvette?
Yes, thank you, Kyisha. Good evening, everyone. My name is Yvette Wright. I am a registered nurse, doula, and also a new author. I currently have a business called Circle of Birth Doula Services, where I service pregnant and postpartum women with the intent to help them have a healthier birth outcome. I do work a full-time job as well. And currently I'm also working on my second book. My first book was published in March of this year. It's called And Hannah Stop Crying. It's Biblical Perspectives of Purpose for Women. So that's a little bit about me.
Awesome. That's awesome. So thank you once again, Yvette and Dr. Dara Cobb-Lewis. I'm Kyisha McRae, and I'm the owner of Growing Perspectives Career Consulting Company. And I'm going to ask you if you experienced any concerns. Yes, please let us know. And I have another colleague helping me on the side, so he's also working on the issue. So please continue to hang in there with us. We will continue with the discussion, and we may return to this discussion later in the month also. So once again, I'm happy that you chose to join us this evening. We have an evening full of discussions related to risk-taking, self-confidence, and the imposter syndrome. So our purpose is to come together today and talk about ways to overcome these three challenges in our careers to help each of us be more successful. So with that, we're going to dive in, and I'm going to ask if someone can just send me a note in the chat to share that you can see the first screen for the presentation. Is that visible? Okay. So we're going to move in. I will start sharing that later. So we will start. Okay, can you see the first screen? I see some thumbs up. Okay, thank you. All right, so we're gonna go ahead and get started. These are the three items we're going to talk about. And as you look at the pictures to the left, you might be able to pick out which one goes with self-confidence. You might be able to pick out the one that looks like it goes with risk-taking. And then you should be able to see the one that looks like the imposter syndrome. You know, feeling like you might not fit in with this group or with this team. So that's what we're going to talk about today. Our time together, we already talked about our introductions. We will have a panel discussion, and then we'll have Q&A, and then we will talk about ways we can stay connected. And we do want to stay connected with you. You know, if any of these topics really speak to you where you are in your career, in your life, we'll talk about ways you can continue to learn more about these. This is just the beginning of our discussion. And just to highlight Growing Perspectives, if this is your first time with us, I just want to share with you that, you know, our mission, we want to help early career and mid-career professionals be successful. And we do that in various ways. Tonight's session is one of the ways that we do that. And our website is www.growingperspectives.com. So we're going to move forward. This is how you can connect with us on all the social media outlets as well. So let's get started. Each of us tonight, we're going to talk about different elements of those 3 items we just looked at. And we're going to start talking about risk-taking first. So I'm going to ask Yvette if she would give us some insight about her experiences with risk-taking. And so first I'm going to ask Yvette if you would share with us how you define risk-taking in regards to our careers.
Thank you. Risk-taking, I view it, it could be both a positive and a negative. It's really, like, to me, kind of like a stretch goal. And you can look at it in different ways depending on day-to-day activities that you're doing within your career, or coming up with, okay, now it's time to switch careers totally. So day-to-day things may be considering, like, being creative, having creative risks, and doing something or thinking of something innovative or out of the box. That overarching risk of going from one career field to another, or from one job to another, is something that I would think that needs to be considered a calculated risk, because you kind of need to plan it out before you jump into it.
That's perfect. That's perfect. So, and I'm going to move to Dara, Dr. Dara, and then I'm going to come back to Yvette. So we're going to kind of do a round table, and then we'll land on one of the items. So imposter syndrome. I'm going to ask Dr. Dara if she can share with us, what does that mean? Because I'm assuming some people may have never heard of that. You know, tell us a little bit more about that.
So imposter syndrome was originally known as imposter phenomenon, and it was a concept that was developed by 2 female psychologists in 1978, Chance and Imes, and it talks about feelings of inadequacy even when you are accomplished, or you well educated, you still feel as though you're not good enough, you're not worthy of being where you are, or as if you're a fraud and you're just waiting to be found out.
Okay. And that is, I mean, just based on what you just said, that's loaded. You know, that sounds like a pretty tough place to be. What you just said, you know, you're functioning in a situation where you're not very confident or assured that you are supposed to be there in this position or in this job.
Though fully qualified.
Though you're fully qualified. Okay. So how can this impact people in their careers?
Well, it has the possibility of keeping you from advancing as far as you otherwise would. As Yvette said, it can keep you from taking those risks that you need to take in order to break through to the next level in your career, or to be brave enough to speak up in a meeting to showcase what your abilities are. So overcoming these feelings is detrimental in helping you get to where you need to be in your career.
Okay, it's perfect. And I will speak a little bit about self-confidence, because I feel like all these are very connected. So if we have a higher level of self-confidence, that might push us to feel like we can take some risk based on what we feel we can do, because we've done it before. We feel like we can be successful. So I think in that case, self-confidence is so important to have also in our jobs and in our careers, because it can help us step out. It can help us feel like we are supposed to be here just what Dr. Dara said, we are qualified. So really stepping into that when we show up on our jobs. So further on in our time together, I'll share some examples of ways that I've seen others use to increase their self-confidence, as well as ways that I've tried also to work in that area. So I feel that those three are connected. So I'm going to go back to Yvette, and we're going to talk about risk-taking some more. What impact do you think risk-taking can have on our careers?
Yeah, so the impact that I think that it can have, as is kind of what I mentioned a little bit before, is about, it can be a negative or it can be a positive, and it just depends on you, the person. So from a negative aspect, if it's an uncalculated risk, meaning you've not thought it out, how it's going to be for you down the line, down the future, and you're just leaping out, then the risk can be unproductive and also counterproductive to what you thought you might want to do. If it's a calculated risk, then it means that you've spent time thinking about it and are thinking about each step down the road and what that's going to look like for you, giving you the visual of where you want to land. And I think that's the key here. I like the picture of the skydiver, because that's kind of really how it is. You want to leap out, but you also want to make sure that you land appropriately in the right place. That's for you. And so risk-taking is individualized also, because my risk-taking is not going to look like your risk-taking. And sometimes risk-taking can look like you're taking a step backwards, but it's actually rerouting you forward, even though it may look like you're taking a step backwards. So that's kind of what I think about how it could impact our career.
That's great. That's great. And I like what you said, that it can look different for each of us, and calculated versus uncalculated risk. And I think that is fantastic. All risk isn't good. That's something that I heard you say, if it's not calculated. So tell us a little bit about your personal career, and have you had to take any risk?
Me, myself, yes.
And tell us, how did that work out for you? And you can choose if you want to share with us if it was a calculated risk or an uncalculated risk.
Yeah, so just whether it's career or not, I am a risk taker just by nature. So yeah, I will do things that probably people around me won't consider doing, but I kind of go by, you never know until you try it. And I never want to have the woulda, coulda, shoulda, but didn't. There's a couple of examples of risk taking focused on career-wise. I left my career as a registered nurse, and I went into real estate and a bunch of other things. I had a lot of burnout from my position, and as a registered nurse, if you're not getting into a specialty, you're kind of gridlocked, if you will. And so I was like, okay, I'm done with this. I'm going to go to school to be a realtor. And I did that, and I had some success in that. I was living in another state at the time. And I then transitioned back into nursing, which is the beauty of being a nurse, because you never want to give up your nursing degree, your licensure. And so I went back and into nursing, and again start to feel humdrum, like something's missing. And so one of the risks that I took also about my career it was taking a position that was actually paying me about $20,000 less than what I was accustomed to. I took it. Now, see, this is what I mean, that it looks different for each individual because you have to map out where you're going. And for me, it was the right move because it was putting me in maternal child health, and it primed me for becoming a doula and hopefully later on a midwife. So that was a financial risk that I took, but I went into it knowing that it was going to be a financial risk, and it felt right with me. It resonated within me. So, you know, another thing that's just kind of coming up is about being your authentic self when you're considering risk taking, because someone would look at me and probably say that risk that I took me backwards, but it didn't. It just rerouted me in the direction that I wanted to go.
That is perfect. That is perfect. And I heard a lot of things there that you shared. You definitely shared that it was calculated. So thank you for sharing that. And it put you on the path where you wanted to go.
Yes. Yes.
So thank you. So
You're
I'm
welcome.
going to transition back to Dr. Dara, and I'm going to talk about, I'm going to ask her how can we see this imposter syndrome show up in ourselves? It could catch us off guard. And, what are some signs that we can see that in other people that we're close to?
Okay, so imposter syndrome shows up as extreme self-doubt. That's one way you can understand what's going on. You don't believe your own resume is one way I might help you understand what it is. You can see on paper who you are, what you've done, your accomplishments, your education. But when you get ready to walk forward in the truth of who you are, you doubt it yourself. You hesitate when it's time to really take on a responsibility because you don't want to be embarrassed or humiliated. One of the things I want to say is that imposter syndrome, I don't want us to give it power. Okay. One of the interesting things is that it is a syndrome that a lot of people recognize within itself. However, when we think about diagnosing individuals with psychological or behavioral health issues, it's not real in that sense. So what I mean is there is a book of diagnoses that people receive. Like if you think about when you go to the doctor and you're diagnosed with high blood pressure or high cholesterol or diabetes or something, or depression or anxiety or any other mental health issue, imposter syndrome is not recognized. So there's a part of itself is an imposter itself because it's not real, but it feels very real to us. And that's the pull and the pull of it from side to side. So one of the things is not to give it power. It is extreme anxiety, right? And one of the things we can also think about is it's often internalized, but part of the challenge is that we exist in systems, and the systems where we exist are often set up. And let me, as a side note, say that imposter syndrome is often seen in women, and in particular women of color. And we find ourselves often in systems that do not affirm our accomplishments or our intelligence or our education. So it's like it's a chicken or egg thing. Did I bring this to the conversation, or did the conversation already start when I walked in the room?
That's awesome. That's awesome. So thank you for sharing that. And my key takeaways from you, and I put it in the chat, is that it is not real, though it may feel real to us. And I really liked all the points that you gave us to think on and process. So I'm going to jump into self-confidence. and how it's connected also. So I remember going to a conference years ago, and a very high level executive in the company who's very successful was sharing his experiences. And one thing he shared with us was sometimes the difference between a person's success is and someone else's success or lack of success is the person being more successful definitely has more. They have confidence. And something that Dr. Dara mentioned is having the opportunity to display your skills, to display your accomplishments. He mentioned that by doing these things, our experiences can help grow our confidence. So it's very connected. So it's very important to, when you're on your jobs, in your career, to make sure that you are aware of ways that you can increase your self-confidence. If you come to a group and you're not as confident as you thought you were or want to be, that's not the end of it. You can still work to build your self-confidence, and often it comes through repeat successes.